Welcome to The Explainer. So today we're going to talk about metformin. It's one of the most widely used drugs out there for type 2 diabetes. We're going to cover everything from the pretty common manageable side effects to the rare but really serious risks you absolutely need to know about.
Okay, so here's our game plan. First, we'll get the basics down. You know, what metformin is and how it works. Then we'll walk through the side effects most people might run into. After that, we'll cover the really serious stuff. And then we'll get into the practical side, how to manage those side effects, and finally, who needs to be extra careful.
All right, first things first. Before we dive into the nitty-gritty, let's make sure we're all on the same page about what metformin actually is and what it's really designed to do inside your body.
So, you've probably heard of it, right? Metformin is often the very first medication doctors turn to for type 2 diabetes. The key thing to remember here is that it helps manage the condition. It doesn't cure it. Its whole job is to get those blood sugar levels back into a healthy, safe zone.
So how does it pull this off? Well, it's pretty clever. It has this kind of 1-2 punch. First, it tells your liver to chill out and make less sugar. Second, it makes your muscles way more receptive to the insulin that's already in your body. And interestingly enough, it's also sometimes used off-label to help treat PCOS. Let's move on to what most people can expect, especially when they're just starting out on this medication. These are the side effects you're definitely going to hear about the most. And here's some really good news. For the vast majority of people, whatever they feel at the beginning is usually temporary. Your body often just needs a little time to adjust to it. You'll probably notice a pattern here, right? Almost this entire list is about your digestive system. Nausea and diarrhea, those are the top two for sure. But you might also get things like bloating, heartburn, or even this weird metallic taste in your mouth. Okay, now we need to shift gears and talk about something really important. These risks are much less common, but they're way more serious. It's absolutely critical you know what to look for. Now, this is a big deal. A boxed warning is the most serious alert the FDA can issue for a drug. It's basically them putting up a giant flashing sign that says, hey, pay close attention. This is a potentially life-threatening risk we're about to talk about.
And the reason for that giant warning is a condition called lactic acidosis. Now, it is incredibly rare, but it happens when metformin builds up in your system and throws your body's entire pH balance out of whack. And let me be perfectly clear, this is always a medical emergency.
So these are the red flags you absolutely cannot ignore. Look at this list. If you're taking metformin and you experience extreme weakness, muscle pain, feel really cold, or, and this is a big one, any trouble breathing, you need to call 911 or get to an emergency room immediately. Don't wait. And this number, this stark number right here, shows exactly why we're being so serious. The death rate can be as high as 50% if it isn't treated right away. Getting help fast is everything. Okay, now that we understand all the risks, let's talk about what you can actually do. There are some very practical steps you can take to minimize those common digestive issues we mentioned earlier and just have a better experience overall. So let's focus on the big 3 common problems: that general upset stomach, feeling nauseous, and diarrhea. The good news is these are exactly the kind of challenges that you can often get under control with a few simple strategies. So here's the playbook. Doctors will almost always start you on a really low dose and then slowly increase it. Taking the pill with food, that's a game changer for a lot of people. You can also ask about an extended release version, which can be much gentler. And one last really important rule: never, ever crush or chew the pills.
Okay, final section. Let's put all the pieces together. It's so important to understand who might be at a higher risk for serious side effects. This is a key part of using this medication safely.
Knowing if you fall into one of these categories is vital. Now, this isn't meant to scare you. It's meant to empower you so you can go to your doctor and have a really smart, informed conversation about whether this is the right and safest choice for you. This table really breaks it down well. Think of it this way. Your kidneys are the cleanup crew for metformin. If they aren't working at 100%, the drug can build up. Same idea with your liver. It gets rid of lactic acid, so if it's struggling, that's a problem. And yeah, heavy alcohol use or having a major surgery coming up, those are critical things you have to talk about with your doctor. So now what? You've got all this information. The final and maybe the most important step is turning all this knowledge into a real, effective conversation with your doctor. What do you actually need to ask? And you know, it all comes down to this. Taking a medication isn't just about getting a prescription, it's about a partnership. When you're informed about the good, the common issues, and the serious risks, you and your doctor can work together as a team to make sure your treatment plan is working and, most importantly, keeping you safe.